Hello, my name is Tasneem Islam, and this is Considering Gene Therapy. Here's what to consider. Due to advancements in technology, scientists and researchers are able to replace a person's mutilated genes for hereditary and incurable diseases. Although its use is limited, those who favor the use of gene therapy believe that it should be put to use to treat diseases like sickle cell disease or cancer. One should consider the costs of therapy, severity of one's condition, and well-being of the patient after therapy when wanting to implement gene therapy. Here's a look at gene therapy's affordability. Despite its risks, gene therapy has done groundbreaking work in treating rare diseases, but it comes at a daunting price of an average of $80,000. Because of its cutting-edge treatment plans, gene therapy is in high demand and there are restrictions on what patients can access. According to Jeffrey Marazzo, Spark Therapeutics chief executive states that the company will have to lower its price in order to cater to patients with a more affordable and pragmatic solution. Marina Cavazana at Neckar's Children's Hospital states that gene therapy shows promising progress and has allowed patients to give up taking opioid painkillers. Deborah Gill of the University of Oxford believes that gene therapy will prove successful and lead to widespread use due to scientists accommodating for certain patients. Here's an example of gene therapy's accomplishments. An example of gene therapy's effectiveness is the treatment of Hassan, a Syrian refugee that had junctional epidermolysis bullosa. This is a skin condition in which skin and blood vessels deteriorate. Doctors genetically modified a section of his skin to correct his mutations. Like all treatments, this therapy comes at a risk, but Dr. Peter Marinkovich, the head doctor of Hassan's case, reports that there hasn't been any immune responses and they are keeping a watchful eye. Here is an example of the risks of gene therapy. Every clinical trial and therapy has its limitations, and the case of Jesse Gelsinger stands as an example. After being injected with a genetically altered virus in his liver, it targeted other organs other than his liver and triggered a systemic inflammatory response. This was seen as a blow to those in favor of gene therapy and highlighted risks that should be taken into consideration. Scientists have been working on how to improve the monitoring of gene therapy to prevent a case like Gelsinger's death from happening again. As you can see on the image to the left, it's a pie chart that highlights which diseases are really treated with gene therapy, the most being cancer diseases and the least being ocular diseases. The image on the right depicts a virus that could kill a person and a virus that could be used to treat a person, which is used in gene therapy. Here's a look at the future of gene therapy. Gene therapy, even with its limitations, has helped those that believe they wouldn't find a cure. As said by Marinkovich, you can't call it a cure, but it's probably getting close. Scientists have been able to help burn victims, immune-deficient patients, and those with insufficient funds. If fully enabled, one should consider if gene therapy is worth the risks of mortality, like the case of Jesse Gelsinger. But Marina Cavazana is confident that the effects of gene therapy will last, with little to no problems on the patients. Many organizations have introduced hefty prices on their treatments, but have attempted to be flexible to those less proficient of health insurance. When put in a broader perspective, gene therapy is beneficial for the future of medical research and the elimination of detrimental diseases.